Everything was blurry, got worse and worse. And first I thought, well, it's just, you know, one of those things. But it just didn't go away, and so I knew something was wrong because my eyes were changed.
The most significant thing was the difference in colors between the two eyes. And I can tell that by looking up the sky with this eye. It looks gray. Look with the good eye, it looks real blue. And that's the first thing I noticed when I got the patch off, the difference, how colors stood out that I couldn't see before.
The people you've just seen and heard have discovered what millions of men and women all over the world discover each year: a cataract. In fact, advances in cataract surgery have made this operation one of the most successful in all of medicine. And in this office, we're proud to provide the most advanced techniques in cataract surgery, including removal of cataracts through very small incisions with little or no need for stitches. In order to understand how cataracts interfere with vision, let's look at a side view of how the eye works. In the normal eye, light enters through an outer layer called the cornea and passes through a transparent lens which focuses the light on a layer of nerves at the back of the eye called the retina. As long as the lens is clear, a sharp image can be formed. When the lens becomes clouded with a cataract, light cannot pass through as easily, and the image you see becomes faint and hazy. Cataracts usually develop over several years and may cause few problems at first. But as the cloudiness spreads through the lens, you begin to have trouble seeing and doing the things that used to be easy. A cataract may be so slight as to seem no worse than a smudge on your glasses. But it can progress to the point where driving, close work, or reading become nearly impossible. Eventually, a cataract may become so severe that you can only tell light from dark. It may take years for a cataract to develop, or it may take only a few months. The severity of your cataract can be determined by the doctor during your eye examination. If a significant cataract is present, cataract surgery can be scheduled. Many years ago, cataract surgery routinely involved a lengthy hospitalization, a long recovery period, and considerable risk. So the operation was delayed as long as possible, usually until the cataract was ripe. A ripe cataract meant that the cataract was so advanced that the patient was nearly blind. Since then, cataract surgery has come a very long way. In fact, today, cataract surgery is so much safer and so much easier on the patient that there is no need to wait until a cataract is extremely advanced or ripe to have surgery. You can consider cataract surgery as soon as your decrease in vision begins to interfere with your daily activities, things you need to do or things you like to do. Modern cataract surgery is a very delicate operation performed by your skilled surgeon with the help of a special operating microscope. The surgery is usually done on an outpatient basis, which means there is no overnight hospital stay. The operation itself usually takes about 30 minutes or less.
As far as pain goes, I didn't have any pain. I had very minimal aching the first night. And I took the Motrin that they gave me, and I slept perfectly well. There was no, I wouldn't call it pain at all. It was just a minor aching.
Your physician will be using an advanced technique of cataract surgery known as phacoemulsification. There are several variations on this technique. You may have heard it called small incision surgery, one-stitch surgery, or even no-stitch surgery. All of these variations share several important advantages over other techniques. They allow the cataract to be removed through the smallest possible incision. They provide for the quickest possible improvement in vision. They are very gentle on the eye. They allow maximum comfort after the operation. And they allow the fastest return to normal activities after surgery. Other methods of cataract surgery involved making a considerably larger incision because the cataract had to be removed from the eye in one large piece. But with the advanced phacoemulsification technique, your surgeon need only make an initial incision about 1/5 of 1 inch long. The cataract is then broken into small fragments using a special instrument that emits high-frequency sound waves. The fragments are then gently vacuumed out of the eye through the small incision. Another important advantage to the phacoemulsification technique is that it allows use of the most advanced artificial lens implants, or intraocular lenses. These are tiny plastic lenses which are permanently inserted into the eye. They restore the focusing power that is lost when your own cloudy lens, or cataract, is removed. In the past, some of the benefits of small incision surgery were lost because the incision had to be greatly enlarged before the artificial lens could be implanted. But the lens which your surgeon plans to use is specially designed to fit through a very small incision. The power of the intraocular lens implant that is best for your eye is determined with the help of two easy and painless measurements of the eye which are done before the surgery. The first, called keratometry, measures the curvature of the front window of the eye, or cornea. The second, called an A-scan, works like sonar to measure the length of the eye. With the help of a computer, these measurements are used to calculate the power of the intraocular lens implant that will be best for your eye. You should also be aware that, as with any surgical procedure, the possibility of complications during and after surgery always exists. Fortunately, such complications are rare, but include loss of vision, hemorrhaging, infection, edema, retinal detachment, IOL decentration and removal, corneal clouding, chronic inflammation, astigmatism, glare, and ptosis, droopy eyelid. Be sure to have any questions regarding these risks answered to your satisfaction before your surgery.
I had the surgery that morning, and I left the hospital about 9:30. I went home with my wife, and we had lunch. Then I went to the church and worked all afternoon on the computer that afternoon. And the next day, my daughter was moving, so I helped her move into their new home. And the next day, I went to out of state to a flea market with my wife, and so I was never really slowed down.
Although the thought of having surgery on the eye may be a little frightening at first, it should be very reassuring to know that cataract surgery is a short and virtually painless operation. With the advanced technique of small incision cataract surgery, most people can return to their normal activities within a matter of days and can see their best in just a few short weeks.